where you encounter sexual harassment in the workspace from people who are supposed to be teaching you. Literally, it was a weekend call and I was in the tea room. The guy comes literally behind from me and they start sort of hugging me in a very uncomfortable way.
And that's a colleague of yours?
That's a colleague, yeah. It's supposed to be my senior.
Yeah.
And I never reported it. I literally, I just froze in the moment and started crying.
How difficult, if it is difficult, maybe it's easy to be a professional, in particular as a doctor and as a woman, let alone being black.
I think we never inculcated the culture of active mentorship. And sometimes you look, because you've got other colleagues of different ethnicity, and you'll hear, your peers saying, oh no, I went to Professor so-and-so's house for tutorials. Exactly.
So the easy access for other ethnicities that you are not provided.
Yeah.
How many times have you been called a nurse?
Always. Always. If I walk in with an intern, for example, a male intern, they are doctor, I'm the nurse.
Oh, welcome to Creative Replay. I'm here with Mawanda and we're doing our podcast in Johannesburg with Dr Zenda.
Yeah.
A sexologist before anything else. Welcome to Rhythm Unplugged. I'm in Mediclinic, Morningside, with Dr Zenda. I want to give you a background to this. How did I become, who's the guest? I'm the guest.
No, I'm the host in terms of I'm hosting you in Joburg,
so
but I'm the guest of the podcast.
It all started with what I call relatively stupid thing in Durban, where they've got this best doctor, best cardiologist, best dermatologist. Obviously, there's no science to it, right? So I get this text from this beautiful doctor, and why are there men only there? Where are the women? And I went back and looked, and said, sure. There wasn't any woman. And then we said, okay, before the end of the year, we have to do something. And largely because I have a daughter who's 22 years old, so there's certain struggles I can foresee, but some of them I can never feel because I'm not a woman. So today we're gonna unpack a lot of stuff, particularly on being a doctor, black and female. How do you juggle all these nuances for that? I've got this lovely book. I'm not promoting it per se, but it's one of those books that resonated with me because my daughter is going to be a professional and she's a woman and working twice as hard is a norm. So I'll take over now, please. Take over. Yeah, and just tell us about who you are.
Yeah.
Why am I here?
Yeah.
Because you invited me, right?
Yes.
Yeah. So
my name is Zenda. I always love to start by saying I come from rural KZN in the South Coast. And I think this is important because it sets the scene in terms of where you come from becomes a part of the journey that you take on. But I am based in Johannesburg at the moment. I work as an obstetrician gynecologist and sexologist. I don't know why people love the sexology part more. It is one of my favorites, I must say.
Yeah.
But yeah, that's predominantly who I am, what I do. Other work that I do, and I think this is where the sexology part has kind of really opened a different space, which is not common in medicine. In medicine, you're taught, you become an intern, you become ComServe, medical officer. If you want to specialize, go specialize. And then public health, private health, and you're just kind of in this confine. And my journey was slightly different. I got into the commercial side of things, be it radio and TV, and that has given a very different flavor and color to the work that I do. And so I'm forever grateful. I always say I've made a lot of mistakes in my life, but my career, I think we got that one right.
Oh yeah, so there are very few people, and I'm one of them, who enjoy their careers. Like people ask me over and over again, I will not change anything if I were to go back to matric.
Yeah.
Back in Menzi.
Yeah.
I'll be what I'm doing now because I love my job. But like I said, I'm a very selfish person. Everybody knows that. Selfish, not in a way that I'm going to backstab someone. I'm not vindictive. Well, I hope so. But when I say I'm the kind of a person who puts myself first, because I think if I'm happy and those around me are happy.
So true.
So I'm going to jump into it because, like I said, I'm doing this because, well, you invited me, but more and above, I have a daughter who's 20 years old who's going to get into an industry, and she's going to face certain challenges. Today, particularly, I want you to unpack how difficult, if it is difficult, maybe it's easy, to be a professional, in particular as a doctor and as a woman, let alone being Black, which is just another topic. But just tell us about being a doctor and being a mother, a partner, or whatever it is, the challenges that you may be facing or faced.
You know, the first story that, in fact, when we set up this podcast, the first story that came to mind is my first day at medical school. In fact, we were doing the registration. I was in UKZN. We did the registration in the main campus, and I was with my parents. And literally, the queues were so long. All I could think about was, I want to vomit. That's how scared I was. And I think that's where also it starts in terms of you are in this completely new space. You don't know anyone. Everybody was excited. Oh, she's going to do medicine. And I was like, you have no idea. I am freaking out. And I think that's where it starts, that fear of the unknown. And it helps if you get into like a space like that and there are people that you can be, who can support you, if I can put it that way. And I think that's one of the biggest things. Medical school is that you always felt like the consultant, the people who were teaching you were somewhere far away.
Sorry to check. I like talking a lot. So you said something, you felt like vomiting, right? So as a doctor, I'm thinking maybe you're vasovagal because you feel so uncomfortable. I've been a doctor for 31 years. And throughout the time, you earn better, you afford certain things, but you still, like when I go shopping, there's certain shops where there are no price tags and it's quiet. And I feel like I don't belong, right? I don't even want to go in. It's only taken me, in the last few years where I can just walk into a shop, I don't have to buy. So as that young girl, long queues, did you feel like you didn't belong?
Yes, very much. I felt like I didn't belong. And here's the thing, I call it, if you can overcome shame in your life, you will do amazing things. There was a shame about, this is a tough one. There was a shame about my results because people assume, oh, you're a doctor, you must have gotten like straight A's. I got a D for maths. I was like, well, it was higher grade, but I still got a D for maths. Luckily, all my other subjects were really good, and it was a point system at the time. You needed a certain number of points. And I remember we had to do copies and submit them to the HR department for something. And I took my certificate, my matric certificate and stuff. And it always kind of played as though, am I supposed to be here? Am I supposed to be here? And I remember the first test that we were going to have, literally there was so remember medical school would open early. So by the time the rest of the campuses
they come in
Feb. There was a mosquito party in just above in one of the buildings. You could hear the music, and I was like, do I go to the mosquito party or do I sit and study? And all I could hear was my dad's voice, just like, he would kill me if he thought, if I was
well raised.
Yeah, I was just like, there is no way. But it's all those things that have played a role in when you don't have a physical body of somebody who's taking you by the hand and walking the journey with you.
Part of it, that's mentorship.
Yeah, absolutely.
I like going back to this story again. I think we have to do this over a month. So she just shared something that I shared at the graduation ceremony with medical students about 2 weeks ago. Mawanda was there, that I was a quota student, right? I got a C overall, and there was no A subject. Well, it was many years ago, I can't recall. But I got good enough. But I was with students who got like 7 A's, 10 A's.
Exactly.
And it's one of the things that I'm glad you raised that point, that being a coach, it doesn't mean that you don't belong.
Yeah.
It's just that we come from these different backgrounds in South Africa.
Yeah.
And look where you are now.
Yeah.
I was the second best medical student at the end of the day. I also worked hard, but I'm sure for you, once again, as a female, just take us through the journey. So that's medical school. Medical school.
And then I was not one of those kids who knew they wanted to be a gynae at 5 years, guys. I literally, and I always call it was like a breadcrumb trail. You know, when you do intern.
Follow the breadcrumbs.
Just follow the breadcrumb trail, that's it. And I remember going through internship and rotating through the different speciality. You go through surgery, I was like, yo. You go through
Why
pediatrics.
not?
So you know what? Actually, And it's funny because gynae or obs and gynae has a surgical part to it. I'm okay with in and out surgery. Anything that takes longer than an hour, I'm like, yo, I used to literally get so flustered by the lights and get hot, especially because as an intern, you are more assisting than being the active surgeon. And I actually realized, even when I started specializing as a gynae, now we're doing longer operations. Actually, when you're the one operating, the adrenaline is so, you don't feel it. The people who feel it the most.
Are those ones
it's the hardest job. It's the assistants that are just standing there, just like
3 hours. Oh, okay.
You know, internship was really relatively great. I had a great experience in Peter Maritzburg. Something that was that also just popped up in internship, and this is something that is quite sensitive. I remember it was actually not even a registrar. He was a medical officer. It was. Let me not say what ethnicity it was, but he wasn't black. And where you encounter sexual harassment in the workspace from people who are supposed to be teaching you. Literally, it was a weekend call, and I was in the tea room. The guy comes literally behind from me, and they start sort of hugging me in a very uncomfortable way.
And that's a colleague of yours?
That's a colleague, yeah. It's supposed to be my senior.
Yeah.
And I never reported it. I literally, I just froze in the moment and started crying.
Did you have a relationship as a friend?
No.
You'd never gone out for coffee?
No, not at all. Even, I remember the first person who taught me how to do a C-section, really, it was this separate story. Great guy, is brilliant at what he does. But he was like, whilst we're busy teaching us, so can I come and visit you later? And I'm just like, so you've always also got this thing that teases out, what do I have to give to be able to be taught fairly? And you would notice...
Or belong.
Or belong, yeah. I mean, you would find, for example, during, reg time, because it's subtle, but you see it. You would think that maybe a lot of the female senior colleagues would take you under their wings. No. A lot of the time, you actually would find that it was the guys. And if you look at your own peers, male peers, you're like, why are they getting more surgeries? Why are they getting more, people are more lenient towards the guys. Those are some of the experiences that kind of you walk in and you're like, okay, I'm on my own.
Zenda, now I want to go back. So I go to Nairobi and many other countries in Africa doing what I do.
Yeah.
I met this beautiful medical student. She's doing a final year and she's into research.
Yeah.
Dr. Muhuhu, young, beautiful girl. And she cried and she said to me, which I got to know her, and she said, one of the very senior medical doctor in Kenya, Nairobi, went to her after she presented her paper and said, you don't have to sleep with this man. And she was like shocked. What do you mean?
What do you mean?
She said, well, for you to be able to be where you are at, you must be sleeping with one of them. So funny because you said you will think that a senior female person in that space, one, will notice it, even though it's subliminal. Two, they will take you under their wing, and it doesn't always happen.
No.
Have you thought about why it doesn't happen that way, or actually another senior figure that you look up to kind of lets you down?
Yeah.
Or let you slide?
One of the things we don't talk about when it comes to, be it medical school, be it, in fact, I think more during reg time, there's this idea that you're the one who wants to specialize, right? So when they say jump, all you say is, I remember we would get told that you can't be sick. Only if you are intubated in ICU are you allowed to miss work. The number of hours that we were putting in for reg time. And to your point about, seniors being protective, it's almost like everybody kind of towed the line in the system. Nobody was like, but this is not right. I used to even look at things like our call rooms, where we would be able to go and sit when you're on call overnight. And I was like, this is just so not conducive for a woman. If you're doing a weekend call, a 24-hour call, we kind of knew that, you're likely to get a UTI sometime in the process. But nobody talks about that, because if you try and ask for anything that seems to be a comfort, or as a woman, it's like, oh, continue week. You guys said you wanted to do this. You kind of want to not disappoint the collective of, you know what?
So that you belong.
So that you belong. Belonging is a big thing, and what we are sometimes put through or are willing to put ourselves through to belong. And I'm glad over the years.
Do you have to do it? Unfortunately, I think as an outsider, you probably have to do certain things to belong.
Absolutely.
I want to go back into a figurative senior female person supposed to be like your custodian, but doesn't. Maybe they've undergone similar treatment, and to avoid, triggering events, maybe they feel that they still want to go up in their careers.
Absolutely.
They must just keep quiet.
Absolutely.
So not stay in your lane.
Stay in your lane, but also I think there's a big thing
So it's sad.
There's inactive mentorship, and I think that's also, there was no real structure. Yes, you would belong to a particular unit, so to speak, but I think we never inculcated the culture of active mentorship. And sometimes you look, because you've got other colleagues of different ethnicity, and you'll hear, your peers saying, oh no, I went to Professor so-and-so's house for tutorials. And I'm like, how?
Oh, not even for tutorials. No, he had a bride.
He had a bride.
Yeah, and he knows my parent. My father is a gynecologist. My mom is a dermatologist, whatever it is.
Exactly.
So the easy access for other ethnicities that you are not provided.
Yeah, even the issue of, that fear you carry along the way, it's because nobody comes to you and say, hey, you're doing good, you'll be fine. If you ever need anything, just call me, right? And you would notice, like I said, that, but other races do it. And the more I kind of, progressed in, finished my reg time, became a specialist, for me, it became really important especially when I was in public health. Whenever I would teach interns, is to be very, it's like I would see myself as that intern.
Just be aware what might be going through their mind, because we have walked that path.
That quiet one who never says anything, who nobody ever asks anything. Hey, how you doing? So what do you want to do? And also being able to guide them. It's almost like a release from this idea that, well, if Dr. Vezi, our senior, went through this route, now we must follow through. And I was like, medicine has changed so much. There are so many different aspects of medicine. Not everybody is meant to specialize. And
we'll come back to that. That's sexology. But to flip the coin, right? So you've got this senior female doctor who appears not to help for the reasons that we mentioned, obviously not all of them. But then, truly, if a 15-year-old guy who is your consultant comes to you and say, Zenda, you can come to my place, I'm having a bride, wouldn't that be misconstrued as then he's hitting on you? So it's a fine line.
It's a fine line.
He either hugs you inappropriately or he does nothing. Or if he says something, it could be misconstrued. So you also find maybe some men who want to be good. They've got daughters at home. They know that they don't want their daughter to be treated this way. So I think it's a fine line. It's
a fine line, but what helps things like that, Brian, is having, like I said, active mentorship, structures that are intentionally put there. If you come into a program and you are told, okay, you've got five consultants, and each consultant, these are your juniors, these are your registrars that you take care of. What are some of the... I remember when I was in high school, for example, when you would come in as a standard 6, grade 8. You would be assigned to...
Is it true? Standard 6, grade 8, okay.
You'd be assigned to a prefect, right? You'd be assigned to a prefect. So you would have things that you do for them. For example, we would go and take their bags in the morning, bring them coffee. It was sort of like, it's like some kind of initiation. But in return, what was really nice was you could go to, they used to have like special dormitories where you could come and drink coffee in the odd hours of, school times. So they kind of became like your sister or your brother. Well, because it was boys and girls, the girls were assigned to the girls and so the boys. The point I'm making is if the structure is not there, then the lines are easily blurred because, let's be fair, we live in a country where there are people who will cross the line. There are people who
and
don't.
they often do.
Yeah. And there are people who don't have good intentions. And there are people who will try and utilize the very thing that they're supposed to be helping you with.
The tools that are supposed to help you.
Yeah, it's like, you know.
I come for a bride, and then
and they punish you.
You can,
and if you say no, they
over?
punish you.
Yeah.
You can sleep over. Wow.
Yeah, I mean, I'm trying to, it can escalate.
It can escalate.
But it'll only tell you when you get to his home for a bride.
Absolutely.
Yeah.
Exactly.
So these challenges are
we have to
at
be
medical
intentional.
school, right?
Made it across.
Yes,
in fact, they're worse off with registrarship because, like I said, I think with being a reg, there's an element of like, you are the one who wants this. And if you don't, you won't pass your exams. If you don't, we will penalize you in not being, we won't sign your logbook for you to be able to write your exams. So there's a lot of things that are riding on it. And I mean, I went in to your other question about other challenges. When I started my reg time 2011, yes. My daughter was 1 year. So also it's that element of I'm a mom, I'm getting in here, I want to be in and out, you know. So you don't want to waste any time. I literally used to have to hide to come back home so that my daughter doesn't see me. I'll sleep first. And then once I wake up, then I'll be like, okay, now she can come to my bedroom. So those are some of the trade-offs that you kind of had to do. How many times do you sleep in hospital as a reg?
Trade-offs, yeah. So there's this thing. So once again, in this talk I gave to medical students, graduation ceremony, and once again, I'm not a woman. As a woman, now you high school or in medical school, what are the challenges that will then decide your career path? Because one, you may need to have a partner supportive.
Yeah.
They may verbalize it, but they may not act it.
Right.
You may want to be a specialist.
Right.
They're going to be supportive.
Yeah.
You want to be a mother.
Yeah.
You want to be a big gynecologist who's running the unit. You know, you want to excel at your job.
Absolutely.
You still want to excel at home. How do you juggle that? And what are the challenges? Can it be done simultaneously? Or you usually want ball drops? Or what are those challenges? I think they're insurmountable.
Yeah.
Probably there is a way around.
Yeah.
Please share with us.
I was and still am very fortunate to have a very supportive dad. Like, my dad looked at me when I was like probably 12, 13, and he was like, you're going to be great.
Your daughter's dad or your dad?
My dad.
Okay.
My dad.
Yeah.
My dad.
Daughters and their fathers. Yeah.
Zenda. He literally looked at me in the eye and was like, you're going to be amazing. And he's always just had that sense of looking at me with, you can do whatever. And so both my parents have even like applications for medical school. They're like, how much what do you need? You're going to do your own applications. What do you want to be? You can become anything. So that for me was the first affirmation. And it kind of did allow me to always, you said something interesting, that you're selfish in the sense that when you are happy, you choose the things that are for you, and then everyone else will benefit from the amazing human being that you become. When I was married, for example, I was married when I started my reg time. My daughter was 1 year. You don't get and by the way, my now ex-husband, he was not in the medical space. So first of all, they don't really understand what really goes on, And it so happened that we had met in medical school. So he kind of had an idea, but I mean, medical school and reg time are worlds apart. Yeah. And now as a wife, as a mom, it's not like, so the support is like, yeah, sure, you can follow your dreams, go become a gynae, but
in reality,
you can't take away the fact that you're still a mom, you're still a wife. So I would have to figure out how to make sure people have eaten in the house before I go on a call. When I come back, I'm still a mom, I must still take care of.
So these are the things that your colleagues, male colleagues, don't have to go through.
They don't, most of the time. Yeah. In fact, sometimes I would always laugh and say, it's crazy, even if you look at how, for example, things like PAs or assistants, women assistants are amazing with male doctors. Yeah. except for mine. Mine is my boss is great with me. But it's those nuances where there's always this idea that when we are around men, we automatically assume Ashem Bandez, it's menzele. Let's do it for you. Whereas when it's the other way around, it's like, why do I have to ask for the bare minimum just to be supported? Well, so my husband at the time, I mean, he wasn't non-supportive, but he was not trying to be. I remember the one time I was like, but I'm not going to be a babysitter. I was like, okay.
Say that again, please.
Yeah. He was like, I'm not going to be a babysitter. And I'm like, what?
So a babysitter, in my understanding, is someone who's employed and get paid to look after a child.
Yeah.
And we hear this a lot from men. I'm babysitting. No, you're not babysitting.
No, you're looking after your own children.
So that's a stereotype that a female doctor has to go through.
Yeah, absolutely.
Your partner, your husband is babysitting.
Yes.
But you need to come back.
Yeah. You need to come back.
Because I need to be somewhere else.
Yes.
Absolutely. And I'll need my plate of food.
Yes.
I remember my mom still married to my dad. She told me a story. She wanted to be a nurse. And my dad said, he's a very bright guy. He said, well, that wasn't bright. He said, well, I'm not going to be coming home and So in his mind, a woman can't do, first of all nurses do night shift.
Yes.
And can buy a favor food, right?
Yeah.
So I can't be coming home, and when are you going away?
You're going away.
Yeah. Yet he says he's supportive.
Yeah.
I mean, that's the end of your career, right?
Yeah.
I'm not going to be babysitting.
Yeah.
Now you may have to choose.
Yeah.
And that takes me back to societal expectations. So your mom is sitting with you, your dad is sitting with you, your community, and you say you want to be professional. My partner, so I digress a little bit, so she went to your dad and said, look, I got good grades, I want to be a doctor.
Yeah.
And he said, for 7 years, how are you going to earn a living?
What do you think is going to happen here at home?
I'm like, Dad, I'm like 17. And he told you, how are you going to earn a living? You know those barriers.
Yeah.
And these are the people who love you. Not that they do love you, but they don't understand what you have to go through, those barriers. So fortunately for you, it comes across as your parents were great at that.
Oh, yeah.
But these are the challenges that you can't run away from.
Yeah, absolutely.
So do you feel as a female in grade 10, early medical school, do you have to choose a certain career based on those barriers?
Yeah. Look, I think we come from such diverse communities, backgrounds. And for me, I was, again, I'm very biased because I had such a strong support from home. There was even sort of like a thing of going into the creative space.
Parents were cool with it.
My parents, I mean, if I look at the diversity of, for example, just my siblings, one did, one is a teacher, one is marketing and advertising.
No, forget your sisters, your daughter.
My daughter is a dancer, for example.
Yeah, so I was excited when I heard that. Right. So you've got a conventional, part being sexology, you've got a conventional profession. Yes. But she chooses to be a dancer, and that's great.
Yeah.
But we'll come back to that.
Yeah.
So once again, do you think that now you're at medical school, you want to be a registrar? Do you feel as a female, do you have to choose non-surgical fraternity where you don't have to work after hours? Because if you're a surgeon, you're going to be called at 2.
Sure.
Then we've got this person who doesn't want to be a babysitter.
Sure.
Or do you choose to be a radiologist? Your hours are flexible.
Yeah.
Do you think that females have to go through that?
Oh yeah, a lot of people chose their speciality based on the convenience.
Convenience for other people, right?
Convenience for other people. That's true. And I was about to say the exact thing about when someone says, "Well, I'm not going to be a babysitter," you're like, it's because they are now sitting in an uncomfortable position of having to do a little bit more because of me. And it's like, no, it's your child too. You were there. Again, for me, I still say I was really fortunate in that I was clear as daylight when it came to my... I mean, when I locked in with Ops and Gynae, I was like, yeah, this is what I want.
You didn't think about the partner at the time?
I thought about everything else afterwards. And I was like...
But the decision was made.
The decision was made. And I was like, great. I will figure it out. Same, even when I was like, no, I'm going to Europe to study sexology. And I was like, well, we were having a chat before we started the recording that even like a lot of my colleagues used to be like, what's this sexology thing you're doing? What's this thing? Because it's not a subspecialty.
Please leave sexology for now because I think we need to delve into that. But so now
you have to consider that. You have to consider some people start specializing when they are sort of like in my position, already married with children, maybe children more than one, and you have to think about that. Some people have to. One of the good friends of mine, they were both doctors, and I remember they wanted to specialize. One wanted to do surgery, and she wanted to do internal medicine, and they were sort of like around the same time. Guess who went in first to specialize?
A man.
Yeah.
I don't have to guess.
Yeah. It was the guy that actually was like, okay, when you kind of sit at home, continue working as an MO.
Make a house a home.
Yes. Whilst I finish.
So that I'm comfortable.
When I am finished, then we can think about. She never specialized.
The dream. So that I spoke about dreams. Sometimes you have to let go of dreams. But it's sad when you let go of your dreams, not because of the lack of potential or opportunities, but you've got to satisfy someone else.
You have to
your dream.
Roadblocks by some. And here's the thing. This is somebody who says they love you. How do you love me if you don't love my dreams? If my dreams don't, I'm not asking you to take them as your own. But if you don't see the excitement, if you don't see the person that I am potentially becoming, and the reality to the challenge is, we see this as well as sort of like they're going to earn more than me, or they're going to have the earning power, more successful, more respect. It's like, there's that as well. So,
and even sometimes if money is not a problem, just because traditionally you're an accountant, you're a doctor, you're a lawyer, kind of like get this special attention.
Yeah.
He may have all the dough, but
yes,
it doesn't have the title.
Yeah.
And we're not slandering man. We're not.
No.
This is just a reality of life. And today, really, I want to hone down on women and profession, in this case, medicine. So these are all the challenges.
Yeah.
I want to go back to certain small things that I've seen. How many times have you been called a nurse?
Always.
Also, obviously, I did.
And I used to be like, I don't get it. You would walk into a ward, you are dressed in scrubs, nurses have a particular uniform. If I walk in with an intern, for example, a male intern, they are doctor, I'm the nurse.
So I remember this very well. I did my internship at Natal State Hospital in 1994, and we had 3 female interns, and all of them had been to medical school together, so I knew them very well. And they would talk about this, and I was dismissive. I was like, but isn't it cute? And they would look at me, and I think it took me like 30 years to realize it was hurting to a certain point.
Yeah.
And they just didn't discuss with me because they probably realized I wouldn't get it.
You wouldn't get it, yes.
So what's a big deal? Well, it's not a big deal because no one calls you a male nurse.
Yes.
Yeah.
I got over it very quickly. And also when you start understanding... Doctors are figuring out discharge, and you're like, okay. But I always give a lot of grace as well. The older you grow, you kind of also want to pick your fights. When you understand the context that we come from as a society, genuinely, maybe they've never seen a female doctor.
Or black.
And they used to say to me, that's one of the reasons why I ran away from...
Dr. Zenda, she lied to me. She said she doesn't exercise and you should see how she looks. And I can talk about this. I'm not body naming because she's a sexologist, so she's comfortable. She's got amazing silhouette. And so Dr. Ntombazana.
In fact, in the urology department in Durban, that was one of the things that was just like, okay, how are we ever going to work? You would be coming to do like either put in a catheter or remove a catheter, and this guy, an old guy, would be like, Mtanami, when was on patala panga pants angeke. angeke kulunge. Even like older women, for example. Now, I know KZN well. I grew up there, and I understand the culture and the context. And you also want to, when it comes to the clients or the community, it didn't bother me much.
So you said something very important, sorry to interject. Pick your battles.
Yeah, you pick your battles.
Yeah.
So I wasn't going to fight and
every day, but because tomorrow you're going to be calling us.
If
you can have a big Dr Zenda here. There'll still be
and they will still. So I would just be like, whatever is comfortable for them. If you prefer, I'd call a male nurse. Please come and assist, please. Fagi catheter. Life goes on. I was like, I'm not coming back. And those are even something as simple as your stature. The taller you are, the louder you are. Now
confident you are.
The more confident you are. Now we're talking personality and
yes, Jenna.
Not even two years, Jenna. More. I mean, I was the quiet background. Yo.
Okay, so probably have a
ask all my people. Ask all my people. I was quiet and very unassuming. I was the kind of person who just would like sit in the background and observe.
I want to go back. Sorry, once again. You said like in the urology department,
yeah.
I mean, but in KZN, that's like, okay, it's the worst, I guess. But a simple thing like as part of examination.
Yes. Exactly.
You know, those are the barriers.
Yeah.
Subtle things, but there are issues nonetheless. So just being a female in that space and things like, so it's very important, I think, to younger female doctors to say, pick your battles.
Yeah, pick your battles.
Because you can't be fighting everything.
No, and not everything, you know, again, that's why I said, if you understand, you can never be a great physician in a community that you don't understand. If I understand what you are saying, for example, and don't pick that fight. Find a male to come and assist. The same way that I used to love, for example, some of the ladies, older ladies, when I was specializing in gynae, they really didn't like being examined by our male colleagues. So when a male colleague comes and asks me to do that, I'm not going to give them hassles. I'm like, don't worry, I got you. You go and because we still, even with Western medicine, we still, it doesn't stand in a vacuum, or it doesn't breathe in a vacuum. We've got cultural norms that we uphold, and we don't have to be inappropriate for us to be good doctors who are excellent in what we do. Singers lastly, just because manje says ngabo dokotela. No.
Okay. What I'm going to ask is very sensitive, and it might offend other people.
Yeah.
In terms of picking your battles, right?
Sure.
So there is a lady. She can wear whatever she wants with a bum shorts, and then goes and takes a taxi rank.
Yeah.
Is it okay then Uguti disregard because she's in that environment? I'm not going to be fighting this every day. I don't have a car. I still have to go to this. Does she have to wear longer skirt, or does she have to continue with a dress code and just ignore these people? Or number 3, she fights every day and continues to wear bum shorts. So as a doctor, now you're in this space.
Yeah.
What do you mean pick your battles and choose them and say, okay, this I'm not going to fight, this I'm going to fight.
Yeah.
For instance, being called a nurse, it may be very offensive to someone else.
Yeah.
You have maybe no male colleague and you have to examine this older guy. How do you navigate that?
Yeah. I think first and foremost, always be authentic, be true, be honest, and you've kind of given 2 different scenarios. Here's the one thing we have an advantage of as doctors, and sometimes we abuse it, is by the time somebody's sitting in front of you as a client, there's already some level of implied consent that I need help and they're in a vulnerable position. And when you give people respect, very often they can bypass even their own prejudices and beliefs about. So if I explain to the guy, listen, we need to do 1, 2, 3 so that pain that you're experiencing can get better. Be human to people. Now, talking about
be human.
Yeah.
Know that. Be human
be
first.
Human.
Before you are a doctor. Because so you say like implied agreement that they will come to you to me, there's also a level of trust before they even
Yes.
walk into your room.
Absolutely.
Particularly in private practice, they know that I'm going to see a female black doctor. So that works to your advantage to a certain degree.
Absolutely.
I never thought of it that way.
But
Use that.
Use
Don't
that.
abuse it.
Don't
use
abuse it. But use it. Get your clients in your corner, or let them know that you are in their corner. It's a partnership, not some kind of a talk down. And for me, that's been one of my favorite, policies in terms of how I work with people. But to your point about wearing what to wear, or get bum shorts. For me, that's not a clothing issue. That's a society issue in terms of how we sexualize things, how and also a level of respect. I remember when I was an intern in Maritzburg, as quickly as in the first 3 months of starting my internship. This is because I used to have to take a taxi from whichever hospital I was in, whichever rotation. In this particular one, I was at Grace. And you would go across the road, catch a taxi to go to where we used to stay, our DQ, because at the time, our doctor's quarters were outside the hospital. And literally, without fail, as you're walking across the street, and I always say, KZN men, but brave, because umuntu angaba emotweni yomgqomo athi dudu ntombi, and you're just like, so there's an element of a practice that has gone on. To be fair, it's disrespectful to women, but it's because it happens.
Is it disrespectful, or is it a term of endearment from his society, where when abona intombi enhle njengawe athi duhle intombi?
Oh, hlike emotweni uzobingelela intombi kahle.
But his dad and his granddad, that's how maybe he met his mom.
Here's where I have a problem. It's when, like you're saying, if you say nothing, then they switch sides. Then they start being derogatory because you did not return the favor. Every day, I got into a taxi and it was empty. It was going to go and pick up other people somewhere else. I got in, and this guy, the driver, was like, I was literally scared. I know that there was probably a joking part to it, but I was genuinely scared at that time. I called my dad.
Tongue in cheek, guys, tongue in cheek. I think the taxi driver thought she's beautiful. Okay, let's leave it at that. Let's wrap it like that. Okay, but I can understand being beautiful because of GPV, right?
Yeah, I mean, also like Mattersburg was not home.
Fine line.
Very fine line. Call my dad immediately. I was like,
Hey, amantombazane nabo
So it's all those things where sometimes it's not even things that are within the work environment, but the space you are in. If I have to take a taxi, if I have to, whatever the case may be, things like if my child is sick.
Do you think then, sorry, I'm coming. Do you think then as a female doctor, do you need a certain dress code before you move on? So I was at medical school teaching for some time. I'm from Mlazing. I think of myself as a very open-minded person.
Sure.
But I put my foot down when medical students will come in crop shots.
No, you can't do that.
So I said, look, man, you're going to be bending over Babu Vezi.
No, you can't do that.
And all he cannot see is your areola and your nipple. Otherwise, he sees everything. So do you feel that also as a female, there is a challenge in terms of how you look, how you dress?
I think it doesn't matter whether it doesn't matter whether you are female or male. Just being respectful to yourself, being respectful to your clients.
And knowing the culture as well.
And understanding the culture, exactly. That's okay.
But someone will say it's my right. And mang signa lazang shugs in a dress code.
Unfortunately, people will have their own. But for me, that's why I say.
Because a guy who was going to skip his name was upumil.
Yeah, again.
No, like your male counterpart. If you a coach, a t-shirt, that's his body silhouette. Now you're showing your body silhouette. Wow, why should it be treated differently?
I don't know. I mean, really cropped up.
So I got into trouble. For that.
Really?
Yeah, I did. I put my foot down and said, I'm not going to give lecture. It wasn't lecture, it was bedside medicine. So, I mean,
You see, if it's in the lecture room, maybe. But bedside medicine. You know, one of the things that our clients or our patients complain about the most? Bedside manner. It's not because you treated them incorrectly. The thing that frustrates a lot of our clients is our bedside manner. And this, unfortunately, is something we can't really curate entirely because we all come from different families. I've always said one of the things I really, people can say whatever they like about Zulus. There's something about inhlonipho and the fiber inhlonipho that we have that I hope we can preserve for many, many generations to come. I think it's a subtle,
but extremely important. Talking about inhlonipho, so and again, we like being nostalgic about feeling that our ways and our time were better. So at medical school, in my class, there were 39. I think there were 39 black African students.
right?
Maybe 10 girls. No, there are more females. So let's say 20. None of them drank alcohol throughout medical school. None of them.
Yeah.
Right. But now, alcohol drinking and maybe alcoholism is ubiquitous. It's everywhere.
Yeah.
And that unfortunately does erode. I'm talking about this because you mentioned the moral fiber and bedside manner. So you will see a lot of students, doctors, it's frowned upon more for females. Unfortunately, we're talking about females now. That they're drinking more and more, and with the drinking, your integrity is eroded.
Yeah.
The fiber of the profession is eroded. It's one of those difficult things to navigate. Right? We're talking about men earlier on and babysitting where men are not supportive. But there's certain things that also female doctors need to be very aware that they are judged acutely and more negative.
Absolutely.
But it's something that you can avoid because you're a doctor.
Yeah.
Right? So drinking has become a huge thing among
your private
doctors.
life.
And we've seen it with the police. We've seen it with the nurses. We've seen it with the priests. I grew up in a place where but manje, people have been bold enough because of the corruption. All right, of neglect of your profession. So we have to be very careful also how we navigate, how we live.
Absolutely.
But beyond that, because this is a very sensitive subject, it's going to rub other people the bad way. But I say it, almost every medical student, every medical doctor drink. I drink as well. I drink. But I started drinking after the age of 35. But it's not about me, it's about females, it's about Zenda. What's your take on alcohol and female doctors?
I think whether we're talking about alcohol, whether we're talking about who you are married to, who you're dating, whatever, that's your private life. Keep it out of your workplace. And I'll even take it as far as, we used to have, like I said, I'll refer to things like, in boarding school. There were certain things that you didn't want to be seen doing whilst you're in your school uniform. So for example, even if I'm wearing scrubs, even if I'm not necessarily within the confines of the hospital, there's a certain way that I want to carry myself if I'm down at
the mall doing
Centre Mall doing my shopping. You don't know bani by your behavior. And yes, you might say it's your right, but your rights also come with the responsibility of the work that you do and the people that you're caring for. So my take on that is like, that's your private life. It should never even feature when it comes to your work. We are fumbling the bag if people are then showing up late because it was a party and
or not even coming to work because you had a difficult night. So you have a daughter. She's 16?
15.
15?
Turning 16. Actually, she's turning 16 in January.
Yeah, my daughter is 22. Just completed her undergrad. She's coming back home soon. Let's just go back. Now you're already a parent. So you started your registrar time. Your daughter was 1 year old.
Yeah.
You just got married. How did you... We've been talking about things in a generalized form.
Sure.
You as Dr. Zenda, how do you find the challenge of being a newlywed young daughter at home, a registrar who has to deal with inappropriate hugs, lack of protection? How did you deal with that? you must have dealt with it in a good way, because
Yeah.
here we are. That's a daughter, and here we are with a sexologist and less so gynecologist.
Why is the gynae word less?
So how do you deal with that? Yeah, early on, 1-year-old daughter,
Yeah.
newlywed, registrar, issues at work,
Yeah.
and you have a dream.
I think it's very you juggle until you don't.
Yeah, you juggle until you don't.
You juggle until you don't.
What do you mean by that?
I mean that at some point something had to give, you know, and the unfortunate part is that it was the relationship that became strained to a point where we were like, you know what, let's go our separate ways. So and I think there's a very big element of who and the dream that I felt so strongly about that kind of rubbed the relationship the wrong way. Because also remember, you're doing calls around the clock. That means you don't have. I always joke and say, doctors, you're always either pre-call, on-call, or post-call. And then, so you miss out on family events. You miss out on things you could be doing with your partner.
With your child.
Or with your child. You know, I thought I got a little bit lucky because she was relatively young. So she couldn't comprehend a lot of the things. It's when I'm home, she was happy.
Yeah.
When I'm not there,
maybe she didn't even know.
She didn't even know how long I was gone for. So I was relatively lucky because I finished my specialty. By the time I finished, she was 4. That's when I made sure evulega. Yeah. But I won't lie. And if we're gonna go
but
into
you had to go to Budapest, Hungary. We'll talk about that just now.
Yeah.
How old was she at the time?
2020. She was about 10. She was 10 years.
That's tricky.
Yeah.
That's tricky. So when we moved, my daughter was 4 or 5, so she started school in Canada. So it was at the age when you finished for your daughter. But I'm not sure if I could have gone later. Actually, I tried, and she was having her own issues at school. How did you manage that now, going to Budapest and flying in and out, doing sexology?
You know, I always say, even all the difficult things come with some kind of a blessing. So by then I was already divorced. So we have a shared custody.
Blessing, divorced.
No, shame for me.
Tongue in cheek, guys.
Yeah. So because we have a shared custody, it was a matter of just trade-offs here and there in terms of times. And the nice thing, because the Budapest program I wasn't stationed there permanently. It was a back and forth, more like it. So I was home enough. And I mean, another. Forget even Budapest, during COVID, we were at work and my daughter is asthmatic, especially in the very early months where we don't know how it's going to affect anybody. Probably for like a solid month or two, my daughter didn't come to my house. She was with her dad because we were scared of what that could potentially do if she caught COVID, maybe from me.
Yeah.
So there's always ways of juggling around it, but it's not easy. I think again it goes back to what's your thing. Once you found your thing, once
you lock on that dream,
once you lock onto that
work.
thing, that dream, there is nothing that I've ever done in my career life that I would say, oh no, I thought it was going to be easy and I saw it in Jay going. I'd be like, oh, so you want to write a book? Like, yeah, sure. Do you have the money for it? No, I don't have the money for it.
On a lighter note,
yeah,
we problem with, right?
Problem, Mina.
First, you're black.
Yeah.
Female.
Yeah.
You want to punch above your weight and be a doctor. And then you become a doctor. Then I'm satisfied. Now you want to be a gynecologist. And then you're not satisfied. Now you want to be a sexologist. Difficult to keep a relationship.
Yeah.
Said tongue in cheek, guys, don't take me too serious. But there are a couple of things with that.
Yeah.
One, you know your dream.
Yeah.
Like you said, you've locked into it. 2, you're willing to sacrifice certain things.
Yeah.
Because in life, the way I look at it, you know, a friend of mine once told me, you've got rubber balls, you've got crystal balls.
Yeah.
You can't afford to drop a rubber ball, it might bounce back,
Yeah.
you know. But there's certain things that you can't, like your kid.
Yeah.
It's a crystal ball. So you're able to navigate that. So you have that perseverance, which I think you have.
You have
I
to.
know, because for you to do all those years, all those hours. So kudos to you. But what made you to keep pushing? Were you trying to prove something as a black female, or you're still following your passion?
Yeah.
Going
Again,
beyond. I mean, you're already
yeah.
a gynecologist.
Yeah.
Right.
Yeah. You know what it is for me, and two things. The one, I'll circle back to my favorite human being, my dad. My dad didn't raise, because we are 4 girls and one brother. He's the youngest. My dad never treated us as male or female. We were just kids. You know, so I've never actually thought in my mind, this is because I'm a female. That's what I encountered in the world that I went into. So to your point about, what was your question again?
Yeah, so the perseverance that, you've achieved all these things, and you've got a daughter.
Yeah.
You've divorced now, but you still want more. It's a huge navigation.
Yeah.
Right.
Yeah.
Yeah.
For me, for me, it's purpose. I'm a believer in purpose, in that there is a God-given thing that He implants in you, and you're supposed to live it out. And, I love Dr. Miles Monroe, for example. He has a saying that no fruit tree ever eats its own fruit. In the sense that I always had a sense of it. It might have started off very generic, medical school, internship. I want to help people. When I was doing, for example, my registrar, and I needed a topic for the final year thesis, I remember speaking to another amazing mentor, Prof. Bockman, and I'll never forget what he said. So I was like, Prof, how do I pick a topic? And he said to me, just take a couple of days, walk around, and I was at Barra at the time, walk around Barra, go on a maternity unit, and then after about 3 days, sit down and write the top 5 things that bother you about women's health. And for me, and then it was like crystal clear. So I've always had that instinctive belief that who we are is a gift, but not just a gift to ourselves, but a gift to other people. And if I don't look after myself as a tree, what kind of fruit am I?
So you're also selfish in a way.
Very much.
Yeah.
For other people.
Yeah, for other
people.
For
the benefit of others.
Because you said you love your job. Like, I love my job. But you had to work very hard to get to where you are. Yeah.
Sure.
Now, tell us about this. So I work in Devon. I've got a guy, Newlands East, who's a sexologist as well.
Yeah.
Titles. So, but I've never come across someone who went to a proper training to become a sexologist. So I was watching one of your podcasts with the late Waras, talking about sex. Obviously, we're delving into that now.
Yeah.
But I want to give you a preamble to your story. So this guy is it's a patient of mine, done a procedure, and then he sits me down and says, "How old are you?" I said, "I'm 56." He says, "Okay, here's a medication. There's a phosphodiesterase inhibitor, Cialis. Take it." I said, "What for?" He says, "Well, men don't talk about it.
Yeah.
So I'm your patient. There's no way you're going to talk to me about your sexual issues." Number 2, apparently, I haven't researched this, it may reduce dementia, the Cialis. And obviously, if you take it every other day or 5 milligrams of it, you're always ready, for the encounter. I started taking it.
And then whatever.
I think I like it.
It worked.
I like it. I don't know about dementia. Maybe all these questions I'm asking now, maybe I'm already demented.
Actually, I know for a fact that one of my good friends as well, a urologist and in the sexual health space as well, Prof. Shingai.
I know him. Yeah.
You guys could have been twins, actually.
I know him. Yeah.
And he always says that. He's
from Zimbabwe originally.
Yeah, he is.
Wonderful person.
Amazing.
Very smart.
Very much. He always says, no, you definitely should, you can take
that medication.
Cialis, that medication, not necessarily when things are wrong, even, prior. And I think it's got to do with age and so on. So
yeah, because
you're not in the wrong.
So when I had COVID, for whatever reason, I just, once again, into our training, I don't know why they did my PSA. So I was very sick. I had COVID pneumonia. I look at my chest X-ray. I had only like a 50-cent coin that was air. The rest was edema. So I knew I was going to die, but well, I'm here now. Someone took my PSA. My PSA was like 40 something. That's like 10 times,
10
right?
times, yeah.
And so the sexologist in them said, no, man, it's also good for your prostate. So I was thinking about dementia, I was thinking about my prostate, but my primary reason for taking it
Of course,
was,
yes.
yeah, of course.
Performance.
Yes. Yeah, please, man, tell us about
Sexology.
Sexology, yes.
So how I encountered sexology for the first time, we were preparing for our final exams in gynae. And I remember seeing in our gynae curriculum, there is literally, I think it's like a 2-page blip on sexual dysfunction. And it literally was like a seed that just grew. My question was, how is it that we've got 2 textbooks about all things reproductive system? And even when we think about, when you ask people, when you think about sex from a medical perspective, what do you think about? Everybody thinks about STIs, unprotected sex, pregnancy, and all the ill health that comes with or associated. But very few people say, oh, I think about pleasure, or I think about, and I must say there was a bit of like a duality in the sense that, not in a bad way. I was married very young. If you ask me, so how was your sex life when you were married? I'm like, I have no idea. It was like just a blur. It's like it was a blur, and you start looking back and realizing actually, whether as a child, whether as a teenager, as an adult, nobody ever teaches you the nuances. Maybe they don't have to spell it out in black and white. And that chapter for me stimulated something. I started researching about sexology, and long behold, I call it a God incident. Bumped into beautiful psychologist who was already in the sexual health space. So we started talking. She's like, "Oh, you'd be great with this team. I'll invite you
Guys,
to."
that's where we are, by the way. That's where we are at the moment, and apparently I need to get this for my partner, and I need to get this for me, right? So yeah, do tell us.
Yeah. So she invited me to one of the academic meetings they were having in about a couple of weeks. I went there, and the rest was history. I've had such a beautiful, beautiful support from that. It's a very small team of clinicians in different areas. So you've got psychiatrists. I'm one of the gynaes. You've got psychologists, physiotherapists that work within this whole space. So we have academic meetings. So that's where I met I always say I've got 2 moms. I've got my biological mom, who took me from, pregnancy until I met Prof. McIntosh. And I think that's another thing that really becomes important about mentorship, or what I call sometimes lifelines, is no matter what the difficulties are, for some reason, if you look around, it might not come from the place you most expect it from, but you're always being thrown lifelines to make sure you get to the next level.
But you need to recognize the lifeline, unfortunately.
Absolutely.
Yeah.
When how they say, when the student is ready, the teacher will appear.
Yeah. Now, we're talking about women in profession now, probably briefly as we wind up, female and sex. You mentioned something earlier on that sex is looked at, we frown upon it, we still do. No matter how educated we are, we don't talk about it. Yeah. As a cardiologist, when I give medication that may influence sex, I don't usually talk to patients about it. But more largely, what I do now, because I'm older, sex is looked like it's for pleasure for the man. But today we're talking about women. Yeah. So what is it that you like to share with women, whether they're professional or not, but we're talking about professional women and their sex, because they still looked at as you have to satisfy your partner, not necessarily you.
Yeah. Look, one thing, even to that book, if I may go there, it's crazy how much culture will trump education. Let me tell you why. My mother was a midwife. She's retired now. She was a midwife. She used to literally work at a clinic across a high school. And I would watch her when when I was in primary. I would watch her talk to a lot of the kids from the high school. She was brilliant at it. And yet when it came to me and it came to us, she literally choked on it. We had the beautiful pleasure of talking that through, and that was part of the reason why I did that book, was because I didn't want to pass that on to my own child. And so in the whole context of females or of women owning their sexual life, I understand, I get it. In fact, it's one of the sort of tension between learning European science or science from the context of, European. And you're like, oh, these people talk about sex like nje. It's like drinking tea every day. And I remember coming back from exams in Europe and thinking, how do I package this in a way that is still palatable for my own people? How do I make sexology, and maybe let me jump and say a good example is when I do, for example, an interview on Ukhozi FM. If you missed the topic or the title in the beginning, you'd swear we were talking about sports. The amount of engagement. Euphemism that's there. Indaba yase-Cameroon bafethu. We're still, it's in the language as well. So for women, I'd like to believe that things are getting better in terms of us being able to talk about it. Now you have even sexologists that look like you that make you or give you the permission to say, hey, it's okay. And for me, how I did it, the best way that I did it was, for example, in the consultations, and maybe let me track back for just 2 seconds. One of the most important things about sex, whether we're talking about it from an academic perspective or your own personal life, if you just cast your mind back to when you first started having sex is awkward, and then suddenly you're like, oh, I've hit a point of no return. I've hit
a cheese spot.
Right? So it is, I had to first, I was not always comfortable to talk about sex. My mentor, Mom McIntosh, she threw me in the deep end, left, right, and center in terms of interviews, but it helped me. And also what was really great about her is I worked with her, so I watched her interact with patients about the topic.
Like your biological mom.
Yes.
But one thing I want to get out of this is, well, now you have females, professional, still wanting to look at sex or perceive sex as to satisfy their partner and not necessarily themselves. Yet they are cringing every time it has to be done to other because they're in pain, postpartum, whatever it is that men don't understand, hormonal, and they do play a role because a lot of men will tell their partner, oh, it was great.
Yeah.
Or I orgasm.
Oh no! No!
And they
you
lie.
You guys always ask,
just make
how was it?
back.
How was it, baby? How was it? And you're like, oh, the pressure to. Even faking orgasms.
So I was coming to that.
Yeah.
Why do women do that?
Belonging.
Belonging.
It's power dynamics within the relationship, and there's even a biological coding that we have, in the sense that I always say we've got 3 superpower hormones in our body as women: estrogen, progesterone, and testosterone. Now, in your reproductive years, they're quite high. We say we peak fertility from like 25 to 35 years of age. And then after 35, things start to decline. But what is happening in your career life, you've kind of gotten older, you're coming into your own, and so
you don't have to please other people more.
No, so the progesterone, for example, is a very calming. It gives us a sort of calm. You've got kids, you've got small kids that you need to take care of. Your estrogen is more your bubbly, your glow, your feel good. Your testosterone is swing on chandeliers and energy. But one of the factors that happens as you go into that perimenopausal phase, particularly that progesterone starts to decline. And if you've ever seen I call them mama 40-something. 40-something-year-old, it's like, in fact, take it or leave it.
Yeah.
We become less tolerant of things that we don't like. So what I often
becomes
see...
more about yourself,
as
it should have been.
As it should have been, So there are a number of factors. And one of the things, reason why we started even doing like social media was just realizing how much, as women, forget how men have impacted us in our day-to-day living, in the choices that we make, a lot of the time we just don't take the time to understand ourselves, know ourselves, both from a physical perspective, from a psychological perspective. What kind of person am I? What kind of
Do you like
relationship?
yourself to make sex better? And I'll tell you before you answer.
Yeah.
Sorry to interject. So at medical school, I had this
When we
friend-
were younger, yes, we
at
used to
medical
lie.
school. So I met her when I was doing second year. She was doing first year. She was doing town planning. I won't reveal more. We're still good friends. We're
Right.
tight. Most people thought we're dating.
Yeah.
And she went through a period of time, maybe 2-3 years,
Yeah.
if not more, when she wasn't seeing anyone.
Right.
And most women don't sleep with someone when they're not seeing anyone, unlike the other species. And then she met this guy.
Right.
And a couple of days, I went to a room and I see all these red marks on a calendar. I said, what's up with this?
Yeah.
And she says to me, oh, those when I was having great sex with my man.
Yeah.
And I said, the other empty one. Said, oh, no, it's just ordinary sex. But they were more red,
Yes.
far more red. I said, oh, wow, good for you. 20 years later, and then we hooking up and we just talking. And I said, hey, at least you had that good spell with that guy. I said,
Yeah.
oh, my God, Brian.
I lied.
It was so bad. So now I'm not sure whether she was being vindictive because they broke up.
Yeah.
But we are always good friends. So I tend to
There's no
believe her.
reason,
There's
yeah.
no reason. She said it was so bad.
Yeah.
Probably initially I was overwhelmed because I hadn't
Yeah.
had sex in a long time.
Yeah.
But I lied to myself. But she couldn't tell me why she lied to herself.
Yeah.
But she wanted this visual.
Yeah.
And she visualized it every day.
And also, I mean,
what's all about that?
when I'm talking to you as my friend, it's the same way. You're not going to go to your friends.
Say I had a premature ejaculation.
Exactly. Like, guys, I've got erectile dysfunction.
Yeah.
Never.
Yeah.
You know. So
You enjoy a game, man.
everybody enjoy a game until sister gaming
Yeah.
right. So though again, it's the shame that comes with thinking that I am not good enough in an area that is so important, for example, in a relationship. That's the one. But the other thing is, for example, if my partner is the one who's got a sexual dysfunction or I'm not enjoying sex for whatever reason, remember, we don't get into relationships purely for the sexual experience, although it can be a deal breaker for a lot of relationships. So, and women have this idea of bargaining. Okay, you know what? He is reliable. He is nice. He is the father of my kids. Thank God. I mean,
He provides.
If pregnancy depended on the level of how good the sex was, whew, ngabe kubi.
Ngabe sikunike production.
Ngakutshela, right? And there's also this perceived thing where women have always thought men know about sex more than they do.
Because men are usually older to their partners, right?
Men might be more experienced in terms of
Bad experience at it.
yeah.
For instance.
But that doesn't mean that they are good at it. And very often one of the discrepancies I see with couples is two people who really love each other, they just can't find each other in terms of sexually. A lot of the times is one, they struggle to talk about it because everybody just like, but secondly, it's the complete unawareness of how differently wired we are. You are linear, you get your testo peak every morning at 5 a.m., in the AMs. And I'm just like, why are you a monster wanting sex every day, twice on Sunday? Meanwhile, you're sitting there thinking, mara lo nkosikazi lona ngimkhiphele inkomo. And she yeah, I mean, she only feels like having sex, once a month, type of thing, which is very often around ovulation. So it's the lack of also understanding how we are wired biologically. And then once you understand that, then you can work with each other's, call it desire, or libidos, and say, let's find what works between the two of us. But a lot of people often, again, from that stigmatization of talking about sex.
Particularly as a woman.
Yeah, as a woman.
Now, you're a service provider.
Yeah.
So you told me that something that I think is quite smart, that you have a box where you ask your patients who didn't necessarily come for sex therapy to say, do you want us to delve into this?
Yeah.
because I think it's quite important.
Yeah, I was well aware
So-
that a lot of, I mean, if you're running a gynae practice, you predominantly see women. And for kind of like, how do you get people to come and actually come through for sex therapy? And I realized it was never going to happen. So we initiated it. So we had a little sort of like a form to fill in. And it just asked top 4 things. Do you have any pain during sex? Do you lubricate well? How is your libido? Do you get an orgasm?
Top of your head, sorry to interrupt.
Yeah.
How many of your patients tick that part? 20%, 10%, 50%?
No, a lot. Like 80%.
So you've liberated that.
Yeah.
Just by virtue of introduction.
Exactly.
So which is that means going back, we're talking about women and careers. So as a female doctor, don't be scared to give your opinion on this subject, particularly if in that field. Because you're an educator, and Doc said earlier on that by the time they come to your rooms, there's that level of confidence in you.
Yeah.
So why not utilize that space as a female now, because you're not going to be misconstrued as the dirty doctor.
Yeah.
Yeah. So, but we've spoken about a lot today.
I've got the best job. I get to talk about sex and not be looked funny about.
Yeah. Well, you have a title, right?
What do you mean?
Sexologist.
Yeah.
Yeah, I don't. So someone might say, what do you know better than me, right? You're a hot doctor.
But
I get that.
But you're still a clinician.
Yes. So that part where you said they come to you with a certain level of trust.
Yes.
And you know
and by the way, I'm gonna be mad at you if I come to you for a heart problem, you fix my heart, but
the medication is.
But then you break my marriage because now I've got.
Also, because I'm older, I talk about these things very freely and say, look, the medication I'm giving you may, not that will.
Well,
if it happens, don't stop the medication, because then your heart will be. Come, let's see how we can navigate. There are other options out there.
Yeah.
So for female doctors, don't be shy to talk about sex. As Doc said, 80%. That's 8 in 10. And even of the 20% who didn't pick it, probably wanted to.
Yes.
But because of their own inhibition. So we should be brave enough as female doctors, we're talking about females today, to land yourself in that space where you feel comfortable to talk about sexual issues.
Yeah.
We'll have to wrap it because Mawanda is like looking at me. He wants to fly back to Durban. As we said, we are hosted by you, right?
Yes.
Dr. Zenda. We are flying back to Durban today. But it's been a pleasure. We are certainly, unless she doesn't want to see us anymore.
Oh, come on.
If we don't do a podcast next year, it's not us, it's Dr. Zenda. We had great pleasure being here. We're going to wrap it up and we'll give you a few seconds to go. This is Rhythm Unplugged episode. I'm with Mawanda. Creative Replay. And with Dr. Zenda. Please just wrap up for us. Being a female, black, professional, and a doctor.
Yeah.
Mom, sister, societal expectation. Give us in 30 seconds.
Sure.
Okay, give me a minute.
If I had to, I mean, I imagine what I would have wanted somebody to tell me as I was exiting medical school in particular, is that it gets better. Fight for your dreams. It really does get better. And when I say it gets better, it's not that it gets easier. You get stronger, you become more confident in who you are and in what you are literally just like, this is what I'm here to do. But the biggest one for me as well is, if you take yourself as a leader in particular, there's a concept that you have to see the future enough for you to be ahead, but also be able to stick your hand behind so that you're not the only one that's moving forward. It cannot be that there will only ever be one sexologist. This thing of first black this, I don't think it's that exciting.
I was telling you about my own.
It's like I'm uncomfortable. Yeah, there should be more. And you've already given me a challenge, and you said, you know what, to open that sexology training in school, and definitely it will happen at some point. But fight for your dreams, fight for you, and the world. You owe the world at least that much, the best version of yourself.
I like the part where you just said it gets better, because now you've got an arsenal, a armamentarium to fight or to withstand these things, choosing your battles. It doesn't get easier, but it gets better because you become more powerful because you've seen this before.
Yeah.
You've sat and thought about, this is what I'm going to fight. This I'm going to take on. This, it's trivial.
Yeah.
I can move on.
Absolutely.
Thank you so much.
Thank you. I mean, you guys flew all the way from Durban, Nagiti. Only Abakaya would do that, I tell you. So I really appreciate you and Mawande for just coming through.
Yeah.
This has been fantastic. Until the next one, we're going to go deeper.
Yeah. I'm buying this for my partner, or I'm getting this?
Get this one.
First.
Get this one first.
For my cheetah?
No, this is not for your partner. This is for the both of you. It's a game you play together.
But for my cheetah, I'm 14, I'm a cheetah.
It's very much. It's more for couples. You get what I'm saying? So they both.
No, I don't. Until I read it, maybe.
They're both board games. So one of the tools that I use to, you'll find people saying, "Yo, we've been married for 10 years. Things have gotten boring," and so people don't even sort of like that creative instinct.
Because they've accepted.
So they don't. Well, the fact that they are coming to see me, it means that they are not accepting.
Oh, okay.
Yeah. But so I utilize stuff like this to say, guys, date night doesn't have to be at a restaurant every single time. Go take a glass of wine at home. Play a board game and see where it leads.
Yeah, no, you told me where to get this from, but thank you very much once again. Creative Replay, thank you for flying all the way to Morningside Mediclinic to be with the sexologist. And sometimes when she's bored, then she does gynae, but she's primarily a sexologist, Dr. Zenda.
That's not true.
Thank you very much.